Screening tests play a critical role in the fight against breast cancer. Some are used to find early signs of breast cancer, while others help doctors take a closer look at any area that appears abnormal. Screening tests can find breast cancer early, when it's most treatable and the chances of survival are highest. That's why getting regular screening and following up with tests and treatment, if cancer is found, can lower your risk of dying from breast cancer. The two breast cancer screening tests used most are mammograms and clinical breast exams. They're used to help find breast cancer in people with no warning signs or symptoms. For women who are at higher risk of breast cancer, a breast MRI may also be used. Mammography is an imaging tool that uses X-rays to create detailed pictures of the breast. These images are called mammograms. A screening mammogram can detect breast cancer in people who don't have any warning signs or symptoms. It's the most effective screening test we have today to find breast cancer in most women. A clinical breast exam is a physical exam where a trained healthcare provider will check your breasts, underarms, and chest area to look and feel for any changes or abnormalities, such as a lump. This exam is typically done at your yearly checkup. A breast MRI uses magnetic fields and a contrast dye that's given through an IV to create a detailed image of the breast. While some people who are at higher risk of breast cancer will have a breast MRI in addition to a screening mammogram, it's not a recommended screening test for women who are at average risk of breast cancer. Breast cancer is often first suspected when you or your healthcare provider find a lump or change in your breast, or when your screening mammogram finds something unusual. Most of the time, these findings don't turn out to be cancer, but the only way to know for sure is by having follow-up tests. These tests may include a diagnostic mammogram or a breast ultrasound. In some cases, a breast MRI may also be recommended. If follow-up tests can't rule out breast cancer, the next step is a biopsy. In this procedure, a small sample of cells or tissue is taken from the abnormal area to check for cancer. A biopsy is the only way to diagnose and confirm breast cancer. Susan G. Komen offers helpful online resources about breast cancer screening and early detection. Within the Screening and Early Detection section of Komen.org, you can learn about screening recommendations from trusted organizations. There's also detailed information about each type of screening and follow-up tests and what you can expect. Komen also has free, downloadable educational resources on these topics as well.